Hi guys. I'm Alex Windsor. I'm a physical therapist out of our South Sound clinic here in University Place. Going to talk to you guys a little about concussion today. Just give you an overview, a primer, and kind of talk about maybe some myths or things that the general public might not quite know. I'm sure you've all heard of concussions in professional sports, college sports. Some of you may have dealt with them yourselves, but hopefully we can dive a little deeper and answer some questions at the end. Okay. So we're covering today just an introduction, so definition, common causes of concussion, symptoms and prognosis, kind of sports prevalence, understanding who's at risk, treatment options, and returning to activity. That includes returning to school and returning to sport because concussion can impact your life in multiple facets. Talk about prevention techniques to hopefully reduce risk of concussion, and then we'll go over some really useful resources that'll kind of be nice for you to go and do some research or education on your own if you're interested. So, a concussion is a sport-related concussion, is a traumatic brain injury caused by a direct blow to the head, neck, or body, resulting in an impulsive force being transmitted to the brain that occurs in sports and exercise activities. So what this really means is any blow to the body or the head obviously can cause a traumatic brain injury. And concussions themselves are classified as mild traumatic brain injuries, meaning they don't always show up on an MRI or a CT scan, and they are more of a clinical diagnosis based on how the patient is presenting or the athlete is presenting to the practitioner evaluating them. You don't always have to be hit in the head. You can get a hit to the body, causing some sort of whiplash mechanism or causing the brain to kind of bounce around within the skull itself and having an injury that way. So, common causes. Today, we're going to be covering sports related injuries. So, that can be any contact sport. But you can also see this from car accidents, from falls, any sort of like physical altercation, or maybe a workplace injury. So, a big thing to know about concussions, and like one big takeaway, is that every concussion is different. They all are unique and can present with a few, or multiple symptoms from this list. So, we have things that are very physical, so like light or noise sensitivities, feeling dizzy or having loss of balance, feeling tired with decreased energy, headaches, or nausea and vomiting. We have things that can be kind of more like social emotional domains. So, kind of, especially those who are kind of prone to mental health disorders or have maybe been diagnosed with one, things like anxieties, nervousness, or sadness can be amplified. And you can feel more emotional as well, in addition to having potentially more irritability or a little more easily angered. Mentally, concussion can affect you as well, especially with cognition. So you may have difficulty with concentration. You may feel like in a fog or slowed down. You could have difficulties with short-term or long-term memory and just trouble thinking clearly. And sleep is a big one too, because sleep is super important for recovery. Sometimes people with concussions or individuals experiencing a concussion can sleep more than normal, less than normal, may have difficulty finding sleep as well. So these are all things to kind of look out, especially if your kid or your athlete or the student is reporting any symptoms of these, or you're noticing them, like in personality changes. So these are good things to look out for. So when we're looking at the data on prognosis of concussions, most of them do get better fairly quickly. So 45% recover within 2 weeks. The majority of people at 77% recover within 4 weeks, and 96% of people recover by 8 weeks post injury. And rehab really helps to improve recovery, and is we recommend it if symptoms are lasting greater than 10 days or the student or athlete is having difficulty reintegrating to school or to the sport. And with a lot of return to sport things, your athletic trainer, if your student's in a high school, is a great resource and can take them through these return to sport protocols, which we'll go over a little bit later. But they're an awesome resource. Definitely would lean on them. So there are some factors that are associated with a protracted recovery, meaning individuals with these kind of demographics may be a little more prone to having longer symptoms or may have a little longer recovery. So a big one is the severity of symptoms post-concussion. So post-injury, if your student or athlete's experiencing like pretty intense symptoms, they may have a little longer recovery. Things, learning disabilities or other disorders such as ADHD, a prior history of concussion, or if the person has a history of migraines or headache disorders and or depression or anxiety, so mental health disorders as well. So when we're talking prevention, the biggest modifier we can do is making some rule changes and modifications. So in youth sports, there's some research showing disallowing headers in younger soccer leagues, limiting body checking in youth hockey has been shown to reduce the risk or incidence of concussions. Making sure we have clear policies and laws that coaches, parents, and the league understand. Essentially, in Washington, this is the Zachary Lightstep law saying that if any student gets injured on the field or court and they're showing signs of concussion, they need to be sat out. We'll go over this kind of mantra that's like, when in doubt, sit them out. It's not worth the risk. Okay. Neck strengthening, the results are a bit mixed. They may help reduce risk, but it's not a magic bullet by any means. The previous two are a little more important. Proper technique, especially with like tackling in football, teaching kids to tackle properly, not leading with their head. And then for other non-traditional sports, skiing, skateboarding, climbing, just wearing a helmet is generally advisable. So when we're talking about prevalence of sports, in boys sports, football, lacrosse, wrestling, soccer, basketball, baseball, those are at higher risk for concussion. And girls, it's soccer, cheerleading, basketball, lacrosse, field hockey, softball. And females are at higher risk of concussion overall when we look at kind of the data and demographics. So usually, if it's a game, a high school game, you're going to have some sort of sideline coverage, an athletic trainer. They're awesome. They'll be there to provide any sideline coverage. Should there be an injury, maybe sometimes there's a sports medicine physician there as well. If not, this tool called the Concussion Recognition Tool 6, because it's the sixth iteration, is kind of used to help the layperson kind of not diagnose, but understand what to do if someone suffers a head injury or a suspected head injury on the field. First and foremost, any of these below ones, the red flags, call an ambulance, have them get checked out. Like we said earlier, it's not worth the risk. When in doubt, we want to sit the athlete out. Okay, and those are neck pain or tenderness, seizure, circumvolutions, loss of vision or double vision, loss of consciousness, increased confusion or deteriorating like mental status or conscious state, so becoming less responsive or drowsy, weakness or numbness and tingling in more than one arm or leg, repeated vomiting, severe increasing headache, increasingly restless, agitated, or combative behaviors, or like a visible deformity of the skull. And these are the major things that it could be more fatal, so we need to get those taken care of first. So here's your little flow chart. Have a silent evaluation. If it's not a setting where that's available by like a healthcare professional, you might consider using the CRT6. There is also something called, I believe it's the Pocket Concussion Tool. If you Google that, that can also help make these little flowchart decisions. Like if it's a younger sporting event or if it's a pickup game or anything, just a random accident. And then, if necessary, if there's any of those danger signs or red flags, call an ambulance and have like a proper healthcare professional evaluate them. And once again, we're just repeating, when in doubt, sit them out. The risk and benefit of continuing playing is not worth it. Here we just have another list of those danger signs or red flags. I'll let you read that on your own. And this is the specific law. So the Zachary Lightstep law, I included like kind of the numbering there if you want to look it up. But yeah, any youth athlete suspected of getting a head injury will be removed from practice or game. The athlete may not return to play until he or she has been evaluated by a licensed healthcare provider and gets clearance to play. Okay. Some really helpful resources on concussion management, education, and just law in general is one, the CDC Heads Up program has a great thing and multiple handouts, multiple videos for both students, healthcare professionals, parents, coaches, so we can get educated and just provide better care to the student athlete and get them back doing what they love sooner. Then the WIAA is specific to Washington State itself, and it kind of goes over concussion management guidelines and is very useful to know as well. So when we talk about rehabilitation, like we said, students with symptoms that are lasting longer than 10 days or so are usually who we see in PT, or if their athletic trainer is not available to or doesn't have the resources to return them or take them these return to learn or return to sport protocols. But initially following an concussion, excuse me, there's an initial period of 48 hours of relative rest. So that includes reduced screen time. They can still do their activities of daily living, but they may not be doing schoolwork. They may not be in school for those days. And then after those 48 hours, it's kind of what we call like a gradual return to just life, going through your normal things, maybe kind of going back to school with some modifications. All right. And then we're going to kind of go over these protocols in the next slides. So when we're talking about accommodations, we want to set the student up for success here. So that really takes a team that can be the parents advocating for the students, students advocating for themselves, teachers being educated and aware of how a student may behave differently if they're experienced a concussion, and then also coaches and any other staff. This could be guidance counselors as well. Okay, so we can make environmental adjustments, so modifying school attendance, and then giving students a little more break, kind of like to lessen the cognitive load, because the brain is really going through this large healing period. After concussion, the brain is in a bit of an energy deficit or an energy crisis, so anything with increased cognition is going to be a little more of a load or a task to the student. Limiting screen time is important too early on, because those visual disturbances can affect symptoms such as headache, dizziness, nausea, etc. Okay, making physical adjustments. So we're going to avoid the risk of any other or further head injury or collision. So this might be modifying PE class to be doing more non-contact things or doing other alternative activities. All right, adjusting the curriculum. So giving students time to complete extra assignments or giving them different ways to demonstrate mastery of the topic they're studying, and adjusting tests such as like you can delay it till the students are feeling a little bit better. And you can also, like we spoke earlier, give them alternate assignments to kind of demonstrate mastery of the topic. And these are all kind of it's going to be a group and a team decision, and you're going to have to talk amongst the students, the teachers, the parents to kind of get to a good conclusion for these. But yeah, don't be afraid to advocate for yourself or your kid. So this is taken from an international concussion consensus statement. So they have basically world experts on concussion came together and decided this is like our optimal, or this is the protocol we agree on for getting kids back to school. So we kind of start with daily activities here, and then we return to some school activities with modification, getting to school part-time, and then kind of gradually returning to a full-time school with no modifications. So return to sports. Your student must be cleared by a healthcare professional to return to play. This is usually a primary care or usually a sports medicine physician, and sometimes be an athletic trainer in some cases. And they have to practice all return to sport testing and must be able to be symptom free and able to participate in non-contact stuff before being cleared. So this is taken from the similar consensus statement and meeting of concussion experts worldwide on kind of how we reintegrate kids to sport. So each of these stages should last roughly 24 hours in an ideal world. There are some criteria. If the student isn't meeting these like progression criteria, there are instructions to go forward or backwards. And again, this is going to be your athletic trainer or your PT taking you through this. Yeah, this is not a self-guided thing. So we start with kind of symptom limited activity. Then we're doing some aerobic exercise. And why aerobic exercise is good is it really improves overall circulation and blood flow to the brain, which is going to help with healing. And this can just be general like walking or biking. So then we get to a little more sport specific exercise where we're kind of doing the sport that the athlete was injured in or their sport of choice, but it's like not near the team. So there's less risk of contact or other injury. Then we're getting back to non-contact training drills. So we're reintegrating into practice here. Then we're returning to full contact practice. And if the student does this successfully, then we can talk about return to sport, and that's return to game and return to play. There is the topic of how many concussions are too many. At what point should a student stop participating in said sport or said activity? There really is no magic number to this. It's a lengthy discussion and a nuanced discussion between the athlete, the family, physicians, other concussion specialists, and it's really just a risk versus benefit analysis. Like, is it worth the risk to continue playing versus the potential risk for injury? Because you get one brain, so you want to take care of it. Okay. And that's all I have for today, but thank you so much. We'll take some questions now.
Thank
And these
you
are my
so
sources.
much.
Oh, sorry,
Yeah.
Sophie.
Thank you so much, Alexander. That was a great presentation. It looks like we do have a few questions here. The first one being, does a loss of consciousness during concussion affect the treatment plan at all?
So, from a treatment perspective, you're definitely given those red flags we went over earlier. You have to go to the ER and get checked out to rule out anything more serious to the brain or the skull or the cervical spine. After that, it doesn't necessarily change too much. We kind of will do a physical therapy evaluation, see what impairments the athlete has, and kind of go from there.
Great, great. Thank you. And then it looks like we have another one. What can I do as a parent to help my child recover from their concussion?
So, a couple of things. The biggest thing is advocating for your kid, getting involved with the process with the teacher, any administrators, and also the guidance counselor, and then just kind of making sure the kid is getting accommodations as needed. So whether that is increased, testing time, increased duration for completing assignments. If the kid is like really sensitive to noise or sound, we might want to get them like hall passes so they can leave class before it gets too busy, or maybe have them eat lunch with some friends in the library, things like that. And the second thing is just educate yourself as well, especially if your kid's involved in a lot of sports. And I mean, Google is a great source these days, things like ChatGPT, I guess, maybe. But then also the Heads Up resource from the CDC is a really great way to kind of get educated on some concussion basics.
Perfect. And then our last one here, it looks like, am I allowed to sleep after getting a concussion?
So yeah, so that is like a past myth. Like you wouldn't have an athlete go to sleep because you're afraid of worsening mental status or further brain injuries and a potential fatal injury. But that's not accurate today. The research is showing that sleep is important for recovering from a concussion. Like that's when our brain and our bodies heal. So making sure your athlete is getting proper sleep in the night and making sure they have good sleep hygiene, which means like not using screens in the bed and making sure we're getting, not intaking caffeine too late and making sure we're on a routine and regular sleep schedule. And you can discuss with your primary care physician about, potential sleep aids if this is something that's really affected. And problems with sleeping is like one of the major symptoms of your athletes having after concussion.
Awesome. Thank you so much. I think that's all we have for today. So thank you all for joining us.
Awesome. Thank you for having me.